Hi guys, my name is Niyati and welcome to this Chegg video tutorial. I'm a tutor here on Chegg Tutors and I mostly tutor biology and medicine. And in this video, I'm going to be talking to you a little bit about the clinical features of diabetes insipidus. So in my last video, I told you what diabetes insipidus was and some of the causes. And in this video, I'm going to tell you about the clinical features. So basically, as we mentioned before, diabetes insipidus is a situation in which you have reduced quantity of antidiuretic hormone or a reduced effect of the antidiuretic hormone on the kidneys. So what this leads to is basically your kidneys to produce a lot of very bland dilute urine. So the clinical features is basically extremely high volume urine, right? And this is leading to a lot of water loss. So this is going to cause excessive thirst. And because of that, you're drinking water, but you're losing um, water through the urine. You're losing a whole lot of dilute um, urine. So this is going to cause the relative sodium concentration in the body to increase, which is a condition that we call hypernatremia. And hypernatremia, if it is severe, then it can be serious and life-threatening because it can cause neurological symptoms like confusion, disorientation, lethargy, weakness, seizures, and coma. So if the hypernatremia is extremely severe, it can be serious. And of course, because you're losing all this fluid, all this water, it's going to cause the person to become dehydrated and it's going to cause volume depletion. So these are the main symptoms of diabetes insipidus. The neurological symptoms are going to occur only if the volume losses are significantly more than the amount of fluid that the patient drinks. So if the patient is losing a high volume of bland dilute urine, but if he's also drinking enough fluid, then he might not have these neurological symptoms, assuming that the fluid is if he's drinking enough water. So only when the patient does not have enough access to water intake, that is when you're going to have very, very severe hypernatremia. So that's something to keep in mind. Apart from the clinical symptoms, the diagnosis of diabetes insipidus is based on certain lab tests, which I will be talking about in my subsequent videos. But clinically, this is what you should look for: a person who complains of extremely large volumes of urine. Whether it is watery or bland, that is actually something that you are only going to be able to test when you measure the osmolarity of the urine. But in terms of clinically, if the urine is very pale, that might be one of the indications. Apart from that, the patient is going to complain of excess thirst. And depending on the level of hypernatremia, you can have these neurological symptoms, like I mentioned. So this was a little bit about the clinical features of diabetes insipidus. In my next video, I will talk about how you diagnose it and subsequently how you treat it as well. I hope you enjoyed this video. Thank you so much for watching and have a great rest of the day. Bye!